The World Health Organization said 4 children were among 6 people wounded in a strike on a polio vaccination center in northern Gaza. UN aid teams had resumed the polio vaccination campaign in parts of the Gaza Strip. It was derailed by Israeli bombardments, mass displacement, and a lack of access to the children who need it. The vaccinations began in September after the first polio case in Gaza was detected in 25 years.
Delayed, but at last underway. Concerned Gazan parents ensure their children get the second round of the polio vaccination in a scaled-back programme originally scheduled for mid-October. Intense Israeli bombings and mass evacuation have disrupted and postponed the procedure after the first round of the vaccinations took place in early September throughout Gaza. Even in the face of the ongoing war, some parents are relieved for the protection.
Despite the shells and bombing over our heads, to protect our children, we came to get the vaccination at the school here, even though the bombing is still over our heads and we are unable to go out to buy food or to eat. But we thank God.
My children got vaccinated because I was afraid they would be paralysed. I've been afraid since I heard a child in Deir el-Balha got paralysed. The World Health Organization, which is helping to administer the vaccine, has noted that the program has been compromised by the limited access.
The final phase of the campaign had aimed to reach an estimated 119,000 children under 10 years old. But achieving that target is now unlikely, as conditions in northern Gaza get worse every day.
The polio vaccination campaign has managed to continue, but the threats to safety for children in Gaza is ongoing for as long as the fighting and bombing continues, with little hope of a ceasefire.
The WHO's Richard Peeperkorn is in Gaza. I asked him about the difficulties they've been facing.
Yeah, we are in the middle of the second round of the campaign, and today we started in northern Gaza. Let me explain again. The overall target was to reach 591,000 children under 10 years of age. We also would co-administer vitamin A to boost the immunity for the children from 2 till 10 years of age as well. The campaign in the south of Gaza, the southern and central zone, up till now has been a success. I mean, like with coverage is over the 90%. However, today we start in the north, and that is much more complex. I will explain why. In the north, we unfortunately have a compromised campaign. The target in the north is 119,000 children to be reached with the polio vaccine. And it is compromised for the following reason. In the first round, the so-called area-specific humanitarian zone was much larger than it is today. Today, this humanitarian area where we have an humanitarian area-specific zone is basically Gaza City. The north of Gaza is not included. And we have been saying this from the start, we will be missing children because of that. Now, over the last couple of weeks, we've all followed the news. And we estimate that approximately 100,000 people have left the north of Gaza, have been forcibly evacuated from the north to Gaza City. So the technical committee, which is existing of the Ministry of Health, WHO, UNICEF and UNRWA, they decided, despite all these challenges, we still would start this campaign in the north.
That was Richard Peeperkorn of the World Health Organization in Gaza.